And it was a full-time job to kind of coordinate all these different specialists and all the appointments that I'm not sure if the average person can handle.
We've recognized that we need to leverage technology and other innovative ways of delivering care to better meet patients' needs.
When it comes to cardiovascular care on the organizational level, MedAxiom understands the challenges your program is facing. Welcome to MedAxiom HeartTalk, the podcast where thought leaders come together for one ultimate goal: to continually transform cardiovascular care for all. MedAxiom HeartTalk starts now.
I'm Melanie Lawson, a journalist in Jacksonville, Florida, and host of MedAxiom HeartTalk. I'm excited to introduce today's topic, access to care, the patient experience. So we have three very special guests today. Mr. Joe Kaler, who's joining us from Milwaukee, Wisconsin. We have Dr. Ty Gluckman from Portland, Oregon, and Ginger Biesbrock from Grand Rapids, Michigan. Thank you all so much for joining us today.
Great to be here.
It's a pleasure to connect with you guys.
Thank you, Melanie. All right, so let's dive right in. So Joe, we know a few things about you. You are a dog lover, a Packers fan, also an avid outdoorsman. And during the peak of the pandemic, you learned that you needed heart surgery. Gosh, that must have been terrifying. What went through your mind when you first found this out?
I knew that I had tricuspid regurgitation, but I didn't have a lot of symptoms about it. So we were kind of watching this over a course of 4 or 5 years. And it was getting to the point where I was starting to get some symptoms, and we could see that it was getting worse and worse. So it was severe tricuspid regurgitation. So we kind of scheduled the surgery and worked around the COVID issues and went ahead with the surgery. From the original consultation with the specialist, that was probably August, I think. Okay. And my surgery was the middle of October.
Okay, so you knew that you needed surgery in August, and then you weren't scheduled for that surgery until October. Let's talk a little bit about the days leading up to the surgery, all those months that you were kind of waiting. Did your doctor's office or hospital offer you a care coordinator or a nurse navigator to make that communication a little better?
I mainly did all the stuff myself, set up the appointments and all that, because it's obviously a complex deal. We were kind of handling 3 different segments, 3 different silos, and trying to coordinate it all. But I'm pretty well versed in a lot of this stuff, so to me it was somewhat routine. But I can imagine for somebody either my age or 5 years older, it would be overwhelming. I don't know how they would do it. I really don't. It was a full-time job to kind of coordinate all these different specialists and all the appointments and several different locations are involved. And so it's a full-time job that I'm not sure if the average person can handle, especially when you mix in the technology with it.
How important do you think, it really is, especially in someone like you, like you're saying, you luckily are very knowledgeable, you had the family and support, but like you're saying, someone that maybe doesn't, how important do you think a care coordinator or a nurse navigator would be during this process?
I think extremely valuable, just for a variety of reasons, just for the communication issue, for the patient-centric kind of attitude. I mean, I really don't know how people would handle the technology, all the phone calls. It's obviously complex, and it would take a person with a skill level in kind of each of the 3 specialties, because they all intertwine. They're all at some point somewhat connected. You just can't treat them as silos. So I think the nurse coordinator or navigator is critical to kind of get this stuff all gelled together so that patients can make sense of what's going on, and would probably avoid a lot of future hospitalizations. I mean, when you've got a satisfied patient that kind of knows what's going on, I would think that would reduce the chances of hospitalizations because of lack of communication. So anyway, I'm a strong advocate of some kind of coordinator that would be able to gel all this stuff together it would pay to have somebody really, really versatile in a lot of different medical issues start drawing out what's going on in your life. And how does that connect to what you had surgically or whatever with the hospital?
I mean, I think that's a great point. And I think even in what we're talking about is with a care coordinator or a nurse or someone, like you're saying, that has that face-to-face contact with someone, they can get to the root of what's going on and then maybe even say, hey, let's look in a different direction based on what this person's telling me.
Exactly.
Dog lovers, Packer fan, you're an avid outdoorsman. I imagine you wanted to get back to those activities as soon as possible. How are you doing now?
Pretty well. I'm pretty much over all the fluid issues, which took, I don't know, maybe 2 months to get over that. And I had to postpone my cardio rehab. So I just entered back into that last week. So that'll help me get back in condition health-wise, heart-wise and all that. They also do a lot with nutrition, lifestyle issues, which is incredibly important to anybody going through something like this.
Wow. Well, I'm glad to hear you and that you are doing better. And I know that you have a team of family members and the knowledge to get through anything else that comes your way. So I think this is a good place to pause for a short message for the MedAxiom community. Heart Talk listeners, stay right with us. We'll be back after the break. We are excited to announce the launch of the new Advanced Practice Provider, APP Hub, on MedAxiom.com. As organizations continue to develop innovative solutions to care for their growing patient populations, many have increased APP utilization. MedAxiom understands the important role of APPs, and we are dedicated to providing tools and resources to help propel them forward. Go to MedAxiom.com/APP Hub. That's MedAxiom.com/APP Hub. Welcome back. Before the break, we talked about some of the challenges Mr. Kaler faced having heart surgery a few months ago. Now let's consider how patient access should look. For that, I like to turn to the experts. Dr. Ty Gluckman, Medical Director of the Center for Cardiovascular Analytics, Research and Data Science at Providence St. Joseph Health, and Ginger Biesbrock, Executive Vice President of Care Transformation here at MedAxiom. On Providence.com, patients have an option for same-day care. The site says this: see a healthcare provider today at a convenient neighborhood urgent or express care clinic, now open with extended hours 7 days a week. Dr. Gluckman, we can see that your city, Portland, has at least 19 of these express care clinics. It sounds like Providence Health is doing something right. How would that have helped avoid some of the hurdles Mr. Kaler experienced?
Yeah, we're trying as best as possible to meet the needs of care for patients where and when they want it. In some cases, these same-day care options exist in urgent care facilities, in retail settings, or standalone kiosks. And we're recognizing more and more that the traditional model of where a patient comes to bricks and mortar between 7 or 8 in the morning and 5 p.m. Monday through Friday doesn't work out for a lot of patients. So I would say even more so in the heels of the COVID-19 pandemic, we've recognized that we need to leverage technology and other innovative ways of delivering care to better meet patients' needs. And for the person who's working full-time, who wants to be seen after hours or on weekends, it's a challenge for them to come to our facilities. We want to make sure that we're best meeting their needs overall.
What other strategies is Providence using to help patients feel truly at the center of care?
It's been a big priority for our organization to listen to our patients and really measure outcomes that matter most to our patients. We're doing this in a number of ways. We obviously get back patient survey data and we listen very intently to that. We're also beginning to pilot efforts to collect longitudinal data about our patients, about how they are doing once they've left our facilities. So I would say that it's unfortunate that in many cases, whether it be open heart surgery or angioplasty, we often are very short-sighted in measuring outcomes for our patients. It may be just how people do in the hospital, how people do over the course of 30 days. So increasingly, we're trying to collect what's referred to as patient-reported outcomes data, where we will have individuals fill out surveys that relate to how do they feel? How are they functioning? Are they able to resume the life that they want to be able to lead? And unequivocally, keeping people out of the hospital, having people have successful procedures is paramount. But above and beyond that, and I would argue equally as important, is to make sure that people feel well after they've received care at our facilities. So that's a key priority for us.
You mentioned clinical outcomes, and we know how important that is. I'm curious about the patient experience as far as their emotional reaction. And how do you truly know that they feel they're at the center of care?
I would say it's a great question. And the reality is there is no one size fits all approach. So we are trying to come up with really a range, a panoply of options that exist for patients to make sure that their voice is heard. In some cases, that's best done in a face-to-face interaction in a clinic. In other cases, just being able to know that they have connectivity to their clinician, to their care team, to the people who are helping to take care of them is what's most important. I'll also say that a large number of our patients want to make sure that their voice is being communicated amongst all of the clinicians. We're fortunate that we're on a common electronic medical record, but regardless of where a patient goes in our health system, there is communication that exists between their care teams, and that provides a heightened level of reassurance that everyone's talking to one another. Finally, as it relates to meeting everybody's needs, I would say that it's hard to do that in a, again, one-size-fits-all approach. So we're doing our best to individualize this. I will tell you that 2, 3, 5 different patients that I may see in a given day, their needs, feeling like their voice, all of their needs are being met, is a challenge, but we find ways to be able to individualize that by giving our patients a range of different options.
And it's interesting. We're in a world where we have access to everything, at our fingertips with the internet and other technology. And so again, I agree with you that I think patients expect that care also when they have a health issue. Let's bring Ginger into the conversation. So Ginger, we had a wonderful talk a few weeks back on Heart Talk. Listeners, make sure you check out that episode on pivoting during the pandemic and improving patient access. But you've helped CV programs all across the country tackle this patient access issue that Mr. Kaler was talking about. So does his experience sound familiar to you?
Yes, absolutely. And I do think that although it's been an issue for a challenge for many years, I think certainly the pandemic has exposed it even more, just our ability to meet our patient needs, again, as Dr. Gluckman described, where they're at and when they have them in a very timely fashion. So I think this definitely brings to the forefront continued opportunity around really making ourselves truly accessible to meet our patient needs.
Where do you think the ball was dropped in his case, or how he could have received more support throughout the whole process?
I think a couple things, and he mentioned the value of a nurse navigator. Our systems are complex, and the patient needs at this point in 2021 are complex, especially when you look at the type of procedures and all the different medications and just the different facets of the care that we're providing. And then if we really want to provide a holistic approach to our patient care, you have additional stakeholders as part of that. And so I think relying on our patients to navigate through that system is extremely challenging. And one of the best practices that has evolved is to develop that navigator role. I think we learned from our oncology friends. They built this role into their care team several years ago, but had great outcomes. And I think we're finding the same thing within cardiovascular, that having that navigator role that can assist with our patients coordinate the care and help them get to where they need to be in a timely fashion. I also think that there's opportunity around what I would call compressed care models. And I've seen this, several programs have done this work and have done this very effectively. And that is bringing the different specialists to the patient and starting to have these interdisciplinary clinics where the patient comes in on one day and we bring in the cardiologist, the surgeon, the electrophysiologist, and a shared care model where they all evaluate the patient same day, in some cases, same time, and then they can collaborate together and really develop an appropriate care plan. And we're finding that from a patient-centric approach, these are incredibly powerful. Certainly from an operational execution, they can be a bit more challenging, but programs are figuring it out. And I think we're finding that this is a really great best practice as well to help, again, navigate our patients through the complex systems that we have.
Right. I think Mr. Kaler is probably the star ideal patient with knowledge, with support, but that certainly isn't the case for many of the patients that you obviously will see.
Yep, absolutely. One other area that I think we're finding is crucial is the care support post-procedure. And so when we start to run into issues or have some symptom management or things that need to be tweaked, if you will, such as the diuretics and that sort of thing, developing a venue within our ambulatory programs that we can get patients in the same day, that we have 24 hours, 7-day-a-week coverage for phone calls from our patients, and then can turn around and see them in the clinic the next day to really help avoid any ED visits or potentially unnecessary hospitalizations is also really important. And traditionally, our surgical programs haven't always been set up that way. They don't even have clinics on a daily basis. If you think about, surgeons spend most of their times in the OR and not very much time in the clinic. And so our ability to pivot and be able to see our patients very quickly has been a challenge. And what we've seen programs do through the use of team-based care models and APPs is develop that same day urgent need type ability to manage these patients very quickly and get them where they need to be in that post-procedure period when managing these symptoms is so crucial. So that's another really important best practice that we've seen evolve.
Mm-hmm. Ginger, are there any other strategies, that we haven't mentioned that programs should consider implementing?
I think it's just kind of what Dr. Gluckman described, and that's really just getting to know your patients and your patient population, understanding that one size doesn't necessarily fit all, but at the same time, I kind of see there's an 80-20 rule, and if we get our systems in place that will predictably manage 80% of the needs that our patient has, the other 20% we can potentially pivot to quickly and really keep that patient level focus. We can do things to manage those, on a one-off basis. So I think the biggest take home is just to think about that patient population you're managing, the objectives of care that need to be met, and how we can best do that in a patient-centric way that meets our patients' needs where they're at, having us navigate for them versus expecting them to navigate through our complex systems.
Mm-hmm. It's already a tough time for them. So the easier you can make that environment and that experience, the better. So Ginger, Joe, Dr. Gluckman, thank you so much for sharing your time and expertise today on MedAxiom HeartTalk. Next time on MedAxiom HeartTalk, cardiac rehab in the COVID era. What are the latest CMS guidelines for intensive cardiac rehab? And what does this mean for your program and your patients? Are virtual modalities helping to fill the COVID-19 treatment gap like CV leaders were hoping? We explore answers to these questions and more on the next MedAxiom HeartTalk. That's it for this episode. If you liked it, please tell your colleagues and let them know they can subscribe to MedAxiom HeartTalk on Apple, Google, or wherever they get their podcast. If you'd like to send us a note directly or suggest a topic, email us at hearttalk@medaxiom.com.